Hello there, I'm Dr. Teresa Lyons, and this week's Ask Dr. Lyons question is, can children get autistic burnout? So last week's video was all about the introduction of what autistic burnout is, and I got several questions from parents who said they have children who are young, and they were asking, can a young child have autistic burnout? So let's look into that. Why try to understand autistic burnout? Autistic burnout is starting to be defined and quantified by researchers. This is a new topic. This is new research that was published in 2020 trying to have a quantification of what high-functioning older people with autism feel. And they've termed it autistic burnout. And it is from a life of chronic stress, and that can lead to distress, loss of work, school, health, quality of life, and even suicidal behavior. So scientists wanted to better understand what high-functioning adults with autism go through in life. And so parents asked, well, I don't have an older child, I have a younger child. So this video is all about how it relates to younger children with autism. So can children experience autistic burnout? It's described as being cumulative, right? So it's a lifetime of chronic stress. So children can experience autistic burnout when they get older, but it obviously starts when they're younger. Autistic burnout isn't something that just mysteriously happens when they're 18, right? It's not like that. It doesn't just come out of the blue. It's really cumulative. So yes, it's important if you have a younger child to be mindful of autistic burnout because you can address it when they're young and not have it build up and then deal with it when they're older. So there is no need to wait until your child is older and potentially experiencing autistic burnout to address it. Address it when they're young. This is the results from the research in 2020 that really started to quantify what autistic burnout is. And so you can see here in the life stressors, right? Masking. So masking is when someone feels they have to pretend, behave a certain way when maybe that's not the way they truly feel. So this is something that people on the higher end of the autism spectrum deal with a lot. So obviously when your child is younger, you can talk to them about their behaviors and if they feel like they're true to who they are. If they're higher functioning, this is the conversation that you can have with them. If they're not, then masking typically is not going to be an issue for them, whether they're younger or older. And the next issue for the life stressors might be something to address, especially if your child is on the lower functioning side. So expectations, regardless of where your child is on the autism spectrum, they might have expectations that they've put on themselves. They might feel expectations from family, from school, from therapists, from doctors, and it's really important to handle expectations. So to really understand, is this something that my child really has the capabilities of doing? So regardless of where they are on the functioning aspect of the spectrum, really having mutually agreed upon expectations is something that can be worked on regardless of their age. So many of these things in this figure from the research article can be addressed when they're younger. You don't have to wait for these to build up. Right? So here, barriers to support, gaslighting, and dismissal. If there's an issue your child is dealing with, regardless of whether they're high functioning or low functioning, it's important not to dismiss them. And I know many of you are not, right? If you're listening to this video, you are a very dedicated and very loving parent. That I know for sure. So you might not be dismissing them, but maybe they have a problem at school and their teacher's like, oh, well, you just need to figure it out, right? And their feelings, their abilities, what they're trying to communicate is being dismissed. Or maybe you're going to a doctor and the doctor's like, yeah, that's just autism, right? So these are all barriers to support that regardless of how old they are, if they're left to build up, this is where that burnout happens when they're older. So maybe finding a good functional medicine doctor when they're younger, when they're 5 or 6 or even 3, right? There's no reason to wait to find quality health care. These are all things that can be addressed when they're younger. Asking for a break, teaching boundaries. These are all absolutely fantastic things that children with autism, regardless of their functioning, you can address this with them. You really can. I love doing this with my clients. So, regardless of functioning level, these issues here can be addressed, and they can be addressed when your child is younger so that you don't have this burnout, this chronic life of stress. This is not what we want for our children. So the younger and younger you can address these different issues, the better it is for your child. So the conclusions for the research is autistic burnout is a syndrome conceptualized as resulting from chronic life stress and a mismatch of expectations and abilities without adequate supports. These are things that can be addressed regardless of the functioning level of your child and regardless of their age. Next steps for this work, this research was small, it was just the beginning, but it's helpful. So this work will be expanded upon, I'm sure, and it's important because not only do they need a control group, but they need to include a diverse group of people with autism. So this study focused only on high-functioning people with autism. They could speak, they could do masking. So to really understand autistic burnout, obviously the different levels of functioning in autism need to be included to understand this. Learn from those ahead of you. This research just came out in 2020. You can apply it to your child, whether they're 3, whether they're 7, whether they're 10, whether they're 15, whether they're 20, and onwards. So learn from the parents and the children that are ahead of you, and you can help address many of these issues now when your child is younger. And the best first step in healing autism is making sure your child's diet is nourishing them and that they are getting quality sleep. These are the best first 2 steps to take for autistic burnout, right? Because when everyone is sleeping and everyone has a nice, nourished, full belly that is able to be digested, then life is a lot easier to handle. Sleep and diet are so important and really the best first steps to take, regardless how old your child is, regardless where they are in the functioning levels of autism. And here's the research if you want to read it on your own.